Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted to welcome a very senior and accomplished professional from the US, Mr. Geoffrey M Roche. Geoffrey, welcome to the show.
Thank you, Ashutosh, and thank you for having me.
Thank you. Geoffrey is the Senior Vice President of National Healthcare Practice and Workforce Partnerships. He is a future of work and education expert, and he is a DEI and belonging advocate. And Geoffrey has been recognized and felicitated several times. So Geoffrey, before we talk about national health and the future of work, tell me a little bit about your own journey.
Yeah, absolutely happy to. So, obviously, actually started my career in hospital administration, without question, significant influence by my mother. My mother is a nurse, and obviously, as a child, I can vividly remember her coming home and talking about the work she was doing in labor and delivery, which obviously is a part of healthcare that is, most of the time, one of the most exciting parts of healthcare.
Yeah.
When I was in college, to be honest, I thought I was going to enter politics. That was really always has been a major passion and love of mine. Had done a Capitol Hill internship in Washington, D.C. at the Capitol, but then really realized that, I did an entire semester at a healthcare system, and I realized the potential that one could have from an administrative opportunity, and that really set me on a path where I landed in my first job, which ended up being just under 10 years at the same organization. It was a transformative experience because it's also what allowed me to first really see the power of mentorship from my CEO, the power of what I call heart leadership from my CEO, and really the influence that she had in really setting me up for not only success, but a real heart and desire to help and serve others.
Very interesting. And, let's quickly, have a quick conversation on the National Healthcare Practice and Workforce Partnerships. Tell me about the work you do, because I'm eager to talk to you about the future of work.
Yeah. So, interestingly enough, obviously the future of work is very, very much intertwined in the work that I do in leading our national healthcare practice. And so core education, where I serve, is essentially an operating partner to many different small to mid-sized colleges and universities around the country. And as an operating partner, our job is to really help put them on a path to prosperity. And I'm sure you're aware that in the United States, higher education is truly at a really interesting point in time. Enrollments are significantly shrinking, yet costs have consistently have gone up. So we're at a really interesting time in higher ed. But if there's a thread that's clear, and I saw this throughout my career, starting in healthcare and then coming into higher education, higher ed, like other industries, has never been very good at threading strategic partnerships. And so my work is really around helping higher education understand the power, the value, and the impact when you do a strategic partnership with healthcare, with IT, with industry. And so a lot of my work is really focused in that thread.
Amazing. And let's talk a little bit about future of work. So based on the work that you have been doing in the past at the National Healthcare Practice, what are some of the trends you are beginning to see as we move forward beyond 2023?
Yeah. Well, obviously we're at a really, interesting point in time globally there. I mean, if you look at healthcare alone, we have a global statistic that is frightening. And that's that, somewhere between 30 to 40%, if not higher, of our global clinical workforce has indicated that by, within the next 5 to 10 years, they're going to leave healthcare.
Wow.
All in all. Now, when you couple that with the fact that we have a gray tsunami occurring across the country here in the US, but also across the world, of people that have worked in healthcare, whether they're clinical or non-clinical, we're at a really interesting time. And I will often say it's a crisis. And I know my colleagues will challenge me on that at times, because they feel like when you say crisis, you're indicating we're up for something that's insurmountable. But the reality of it is that if you don't take a laser focus to address these issues with the way we would with a crisis, we're going to only continue to face this, because we've been talking about these workforce issues for a long time. I also want to say that, so we have this significant supply and demand issue, not unknown. But the one issue that's really creeped up, and in many ways it's come up because of the pandemic, is in our workplaces, we have a significant issue with culture.
Correct.
We have not done enough to really create culture that supports, empowers, lifts up all people. And so when I talk about the future of work, you will always hear me talk about diversity, equity, inclusion, and belonging. And ultimately, I'm sure you're familiar with, and I'm sure many of your listeners will be familiar with, our Surgeon General, who's also from India, Dr. Vivek Murthy, who I think the world of Dr. Murthy, because he has realized this issue in this crisis. And he put together a report several months ago that specifically highlighted on the workplace. One of the things in there that he highlighted was that mental health and belonging has now become one of the most significant issues in the workplace. Well, you know as well as I do that if you peel back that onion, culture, engagement is all over that.
Correct. Well said. Well said. And you just spoke a little bit about the pandemic, but the pandemic has already redefined the workplace. I'd love to get your perspective on what do you think has happened, and do you see a return to status quo ante?
No, I don't really see a return to status quo. What I do see, though, is that, to your point, the pandemic changed everything in the workplace. And so many companies have, were forced to go hybrid, were forced to go virtual or remote. And the reality of it is that a lot of companies, all sizes, were not prepared for that. And despite the fact that we've now been in this, in this new normal, or whatever you want to call it, for over 3 years, they still haven't figured out exactly how you do it. And so there's been a lot more facts and statistics reports lately that have highlighted that during this time of remote work, mental health issues have actually increased.
Right.
Well, when you peel that back, again, it goes back to culture. It goes back to what have leaders in the workplace done to create that culture where an employee feels they can be supported. Because the reality of it is many people would say people that are working remotely are probably working more hours. They probably have a less work-life balance. One of the things Dr. Murthy's report called for was that work-life balance. And so I think we have a lot of work to do when it comes to the workplace.
Right. Well said. But it's also believed that most of the high-value work will in future be cognitive in nature. How is technology going to change the workplace?
Oh, I think, we're seeing technology change it in every way now. I mean, I think even in healthcare, where we're, continuing to talk about the power of artificial intelligence and various different modalities, we see it significantly changing. Here's the thing, though. I mean, and this is, obviously something I regularly speak on as well, is that there's great benefits that technology can have, but I think what we have to make sure we don't allow to occur is we can't take the human-centered aspects out of this. And so while technology can be a benefit, we've actually seen in some industries where technology has actually hindered some progress. And I'll give you a direct example. In healthcare, in the United States, as you may recall, we had a big push a number of years ago for electronic medical records. Well, guess what? It's helped at some level, but it also has taken our providers out of being fully focused on the patient, because guess what they're doing when you're at an appointment? They're typing on the computer.
Yes.
That's not patient care. That you might as well go talk to the computer and act as if you're providing the computer care. So we have to have a balance. And particularly in healthcare, I always say healthcare starts with an H for a reason. It's about humanity. And we have to get back to the focus of what we're there to do.
I love this common healthcare starts with H, because that H stands for humanity. Fantastic. So, Geoffrey, in an increasingly digital economy and the adoption of artificial intelligence, and more recently, the hero of technology, I think, ChatGPT, how do you see workplace change? How do you see healthcare workplace change?
Yeah, it's very intriguing, because obviously there's a lot to be said about the power of AI. For example, just this week, I was watching a news segment on, how AI is further being, brought into different diagnostic, technologies that further detect cancer, particularly in breast cancer. And so, that type of that type of innovation is so necessary. And I'm definitely encouraged by it. Where I get a little bit concerned, however, is in a world where we have so much cybersecurity hacking occurring. We have to make sure that whatever technologies we have, whether it's the chat GPTs, whether it's any technologies, particularly in healthcare, but other industries as well, are truly well protected. Because every day we're getting news of a healthcare system that's been hacked, and patient data is so important. Just recently, the Federal Trade Commission has taken some additional actions here in the United States to crack down, particularly on organizations that are sharing consumer protected information without consent. So as we further see an evolution of technologies, I would just encourage all of us to be mindful of, we still own that information, and it's our information, and we have to make sure it's protected.
Well said. The other thing that I was reading and talking to a few other people was on the smart machines and the metaverse. And there people are saying that what used to be distance, healthcare, using those big satellites, I've now started to move into the metaverse. I'd love to get your perspective on how are technologies like the metaverse going to change healthcare?
Yeah, there's definitely a lot of discussion in this case, and I think, like we've had, before when we first saw the adoption of telehealth, which if you recall, at least even globally, but even in the United States, people didn't jump to it. It took a little bit of time, and then obviously pandemic happened, and majority of people, I shouldn't say majority, because let me be honest about technology. There's a lot of conversation today also around tequity. Or tech equity. And here's the thing about technology, even the metaverse. Will it happen? I'm sure. But will it truly move the needle and address health equity is the question. Even telemedicine has been cited as kind of a have and have nots type of situation.
Correct.
Depending on where you live, you don't have broadband. Depending on your background or your financial acumen, you may not even have access to technology. And so whatever we do in healthcare, we've got to, again, get back to the basics. And it has to be focused on, how do we meet the need of every unique individual patient? And technology can help if it's been developed by individuals who understand equity. I can't highlight that enough, because we've seen technology after technology been developed backed by the biggest venture capitalists in the world, and it still doesn't address issues of equity. We'll never move this world forward if we don't address issues of equity.
Well said. The next question to you is, and you just spoke about the haves and the have-nots. Do you see all the technology and the future of work in the healthcare space actually dividing or creating a bigger divide in the world?
It's definitely a possibility, and obviously we saw that even during COVID. Particularly with the vaccination. I mean, look, countries that had access, countries that had resources, certainly were in a much stronger position than other countries. And I think what concerns me about this is that we sit at a time here in the United States with a pretty divided country. Where if you would speak to half of the country, they don't want to see us helping other parts of the world. Now, I have a very different take. My family came from Germany and left Germany because of the challenges that existed there, and really the terrible leadership that led to a terrible time and era, not just in German history, but our world history. If we do not pay attention, and if we do not, as the United States, do what we can to support other countries, we will see history repeat itself. When history repeats itself, it will pull us back in. And so I'm a firm believer that particularly the United States of America has not only a duty and a responsibility, but when it comes to issues of healthcare, like other countries that have advanced technology, advanced forms of healthcare, we've got to be at the table to help others. Now, let me just say, we have our own challenges here too when it comes to issues of equity, and we've got to address those too. But as a world leader, we need to be willing, able at all times to do the same across the world.
Well said. Let's now move to diversity, equity, and inclusion. I'd like to get your perspective on how is DEI being handled in the healthcare world?
Yeah. So, healthcare is definitely a place that has made some enormous strides in diversity, equity, inclusion, and belonging. And it's definitely been wonderful to see, because it's been absolutely critical and necessary. The reality, though, is in many cases, that work was increased, or in some cases started, because of the unfortunate murder of George Floyd. So in the United States, when George Floyd was murdered, many healthcare leaders realized we've got to do more, because there was so much conversation on race relations again.
Correct.
And when you think about it, in 2022, at that time, now 2023, we shouldn't have to be talking about these things like we have now for the past 50, 60, 70, 80, 90 years. We should be able to have systemic solutions in place. However, healthcare systems have, without question, brought more chief diversity officers on, established diversity committees at all levels. And there's some really, really, really good work occurring to really not only think about it from the employee side, but also think about it from the patient side. What are we doing to have a more culturally prepared workforce? What are we doing to ensure that from an employee level, they have the support, irregardless of the color of their skin, or regardless of whether they identify as a member of the LGBTQ plus community? And I can't highlight how important this is, because a good friend of mine, Josh Miller, has this great project called the Covering Project. In fact, I would encourage you at some point to talk to Josh, because the Covering Project is a really interesting one. And the idea here is that in the workplace, people cover who they are. And people don't always think about this, but it's so true, in that people will cover who they are because they're afraid of the repercussions. And a lot of times this comes around issues of belonging.
Correct.
And so we have to be really intentional around this work.
And yet, Geoffrey, one of the things I have noticed, which is an incredible positive in the healthcare space, not just in the US or India, but in most parts of the world, is that there is an incredible amount of diversity because of the number of people from where healthcare workers come. And because it's patient lives at stake, equity and inclusion of this diverse group is also very, very enabled. I'd love to get your perspective.
Yeah, to a point, yes. But what I would say, at least in the United States, and certainly I can't speak to India with the same level of expertise, but in the United States, we definitely see more and more diverse workforces. Absolutely. What we don't see, however, is more diverse leadership.
Okay.
And until we see that happen, we're not going to make the changes that are necessary. And so if you look at the United States today, even if you look at the percentage of women that hold leadership roles, it's very, very low. If you look at the position, the percentage of women and other levels of diversity that serve on health system boards, it's extremely low. And so we really have to move the needle in that space. Just yesterday, earlier this week, we celebrated International Women's Day.
Correct.
And one of the things that's interesting about that is, we still have difference of pay. We have difference of lot, position included. And in healthcare, I hate to say it, but it's extremely different. If you're a female CEO, 9 times out of 10, at the same size healthcare system, you will be making significantly less than a male counterpart at another.
Wow.
That can't continue.
Correct.
Because you know what? Look, I'll be the first to say this. I served under multiple CEOs in healthcare. One was a female, happened to be a nurse. One was a male. And I would go toe to toe at any time to say that female CEO was not only the best leader I ever worked for, but the best CEO that I ever worked for. And so we shouldn't have this dichotomy in the United States, nor should we have it anywhere.
Absolutely. And I completely agree with you. I've always said, and I worked with a lot of women leaders in my career, I've always said, in terms of work ethics, I think women leaders, women employees score significantly higher than men do, but you're absolutely right on that. So my next question to you, and I've again asked this from many women leaders, who have got onto boards, and you spoke about, inclusion on boards. And I said that, yes, because of policy, because of a lot of talk, you found a place inside the boardroom. Have they given you a voice and majority of them has said no.
Yeah.
What are your thoughts?
I agree. Because the reality of it is just getting to the table is not enough.
Correct.
Once you've reached the table, does the boardroom, does the cabinet, does the team really provide not only that level of belonging, but do they empower across the board? And so I've seen it. We all have seen it. We've all served on boards. And I was fortunate to work for leaders who have always believed strongly in these issues. And so what I have done purposely is when I've been on a board where I've seen others not allowing other board members to have a voice, I will always make sure they get a voice. And so one of the reasons I leaned in to the issues of diversity, equity, inclusion, and belonging is not just because as a young child, I was coached on these things from my own grandmother, but also because a mentor of mine who happens to be a global leader in diversity, equity, inclusion, particularly in healthcare, said to me a number of years ago, Geoffrey, use your white privilege to get other people not only to the table, but to get their voices heard. She said, if you could do just that, she said, you will have accomplished so much of what Dr. Martin Luther King Jr. asked of each of one of us. And so that was one of those aha moments for me, where she literally said to me, you're not doing enough in leadership. Do more. And so I have been intentional, at times getting into good trouble because it's necessary, to say, wait a second, why are you not hearing what she's saying? Why are you not hearing what they're saying? And as my current leader will say to me, you're not afraid to ask any question, are you? And so I've leaned in purposely because it's really, really important that all of us do that.
Wonderful. And more power to you. I mean, I think leaders like you can make a big difference in diversity, equity, inclusion, and belonging. So, Geoffrey, I've got time for one more question. And this question is for the thousands of people who will listen to our conversation. Based on the incredible amount of knowledge you have, the work that you've done in the world of healthcare, we spoke about future of work and DEI. What would you say are 3 lessons you would want our young viewers and listeners to take away from your own journey and our conversation?
Yeah. The first I would say, particularly to a young leader, is don't let anybody define who you are. Make it your path, be persistent, certainly be perseverant to ensure that you define who you are.
Correct.
The second would be passionate. Whatever you do, bring an enormous level of passion to that work, because nobody can question passion. And then the third would be always have a continuous commitment to learning. All of us leaders, I always say leadership starts with L, which is learning. If you're a leader, we have not only a duty and responsibility to learn, but we also have a duty and responsibility to provide everyone else the opportunity to learn. And so those were the 3 that come to mind for me at this.
Fabulous. And on that note, Geoffrey, and your 3 wonderful lessons, don't let anybody define who you are. Be passionate about whatever you choose to do. And the third one you said was have a continuous commitment to learning. And I love the way you also mentioned L for learning is also L for leadership. Thank you so much for speaking to me about your own journey. Thank you for speaking to me about the future of work and so many different aspects of how you see the future of work evolving, not just in the healthcare space, but also in the US and in the world. Thank you also for talking to me about diversity, equity, inclusion, and belonging, and some of your deep thoughts on how you are, as one of your friends told you, using your privilege to be able to enforce and make life so much better for people who don't have that. Thank you for speaking to me, and good luck to you.
Thank you so much as well. And thank you for all that you do.
Thank you. Thank you for listening to the brand called You Videocast and Podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website, www.tbcy.in, to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the brand called you.